Hi RMH, I'm Eliza and I would love to join your social work department and make my contribution. I enjoy working within a team, I have great communication skills and a friendly manner. I am always looking to grow as a practitioner and a person by learning through critical reflection and keeping up to date on the latest theories. While I haven't worked in the hospital setting since my student placement, I am confident in my ability to quickly refresh my skills. And my work with the NDIS has given me much relevant experience that I could use in this role. This includes interviewing families and conducting assessments, being knowledgeable about external services and making referrals, and the all-important documentation and following protocol. So I will describe a time when I was working with the NDIS where I found it a little challenging to balance evidence-based practice with a person-centred approach. I was working with a mother whose child I had deemed not eligible for NDIS funding. We were conducting early supports, the aim of which was to discuss parenting strategies to support their child's development and work towards goals important for the family. This mother was looking to manage her son's difficult behaviour with a rewards chart. Now, my understanding of the research is that this can actually be counterproductive to encouraging the desired behaviour, as the child comes to expect a reward and ceases the behaviour if not given one. Meanwhile, I'm trying to maintain a positive therapeutic relationship with the mother, who I perceive to be somewhat resistant. At this point, I have a choice to either attempt to dissuade her from what she's sure she wants, or educate her while respecting the path that she wants to take. I perceived that she was at risk of becoming distrustful of social services, so I chose in the end to prioritise the relationship in the hope that she would stay engaged in the future. So I helped her to set up a rewards chart while discussing with her the known downsides and providing her with alternative strategies if she couldn't meet her goal. Now, to me, there are some similarities between this and the case study given. As social workers, we need to balance the responsibility of being accountable to patient safety, as well as respecting individual personhood. As the case study states that he's cognitively intact, I'm going to assume that a cognitive assessment was done recently. So as his desire is to go home, I would be focusing my work on preparing for discharge, discussing with him the risks, and making sure that he has a plan for the future. I'd begin my psychosocial assessment by seeing if he has any other community supports, things that he takes interest in. Is he socially active, or would he be open to other community-based activities? After building rapport and demonstrating respect for his goal of independence, I would want to determine his views regarding his decline. Does he have a plan for the future? What happens if he falls again and is rehospitalised? And how does he see the end of his life looking? Does he see residential aged care as something that he may need in the future, or is he opposed to it entirely? I would want to discuss his history of drinking and see what alcohol is doing for him, and whether there are any underlying psychological issues that we could address. I would want to draw on his strengths, which he would clearly have as a man of his age and independence, to see if he's able to cope without drinking that would put him in increased risk of fall. I would also want to discuss his relationship with his daughter. Has there been any conflict there that means that she's not been visiting, or is it just because she lives further away? I would want to speak with the daughter to see if she understands her father's situation and if they've discussed plans for the future as he gets older. She may need some preparation about the fact that he may need her more in the future. And, sort of finally, I would want to know if he's eating the meals supplied by the home care package, and whether the medical team sees his malnutrition abating with treatment or if they expect it to get worse. In consultation with the dietitian, I would work with the meals provider to make sure that they're dietarily appropriate. I would also want to speak with the carer to gain more information about her understanding of his situation and what her hours are. If possible, increasing hours for the carer might decrease his risk of fall. And as usual, in a multidisciplinary team, I would be hearing from OT physiotherapy about if there's anything else we can provide him to promote safety at home, such as home notifications, a fall alarm. So yeah, that's all from me. Thank you so much for your time, and I really hope to hear from you again.